Welcome everyone, and thank you for joining us for today's open enrollment webinar. Before I get started, I'd like to ask people attending today if they could put their name and their site information into the chat box so we know who's here. My name is Ann Calican, and I am the Bridge Team Senior Program Coordinator and a Health Insurance Enrollment Specialist. I am also, slides. Whoops. Sorry. I'm just reading off the slides. So I am also a certified Medicare Shine counselor. My colleagues, David Huckle and Juan Diaz from the Bridge team will join me for this webinar as well. And Kevin Herwig, who is the Senior Manager of HIV Biomedical Intervention Program, will join us at the end of the webinar to discuss PrEP and PEP programs. Next slide. This is an overview of the topics we will cover today, mostly focused on open enrollment, but I'm going to begin with some HDAP program info, updates, and reminders before we dive into the open enrollment slides. We will have time at the end of this webinar for Q&A, and I encourage you to type any questions you have into the chat as you have them, and we'll answer these questions during the Q&A. Next slide. Keeping clients active in HDAP is a best practice and a safety net. A client who doesn't need HDAP or CHI coverage today could have a sudden change in circumstance and benefit from medication copay assistance, which is especially helpful for clients who are aging into Medicare or those with an insurance change or a loss of mass health coverage. Temporary 100% medication assistance coverage for clients who have had an unexpected gap in insurance coverage, and premium assistance through HDAP's CHI program as clients need help paying for insurance premiums. Please, as a second note, please remember to notify HDAP and CHI about insurance changes prior to the date that change actually takes effect, if possible. Doing this can help a client avoid problems at the pharmacy and keep their insurance active, especially if their premium has increased as a result of this change. Next slide. Please send sensitive or confidential client documents to HDAP, CHI, and Bridge staff using secure email. We encourage you to use CRI's ZizCorp secure email portal, especially for urgent payment documents and applications that need urgent screening. The portal is really the fastest and most efficient way to send documents to HDAP, CHI, and Bridge. Instructions for using the portal are on this slide, but can also be found on the CRI website. Once you've created an account and logged in, you can select the Compose tab, select the team you're trying to contact, HDAP, CHI, or Bridge, from the drop-down. Type your message, attach all relevant documents, and click send. Documents can also be faxed to HDAP, but if you have faxed an urgent document, please call the main CRI number and report the date, time, and number of pages in the fax so we can identify your urgent document quickly. Documents that do not require urgent processing can also be mailed to CRI at the address on this slide. Next slide. This slide contains details on who you should contact at HDAP based on the type of question or problem you are looking to address. After dialing the main CRI number, you can press the number 1, followed by the individual number for the you are trying to reach. HDAP is number 2, CHI is number 3, Bridge is number 5. As far as contacting teams, contact HDAP if you are calling with any general questions related to HDAP status, eligibility, updates to a client's insurance coverage, pharmacy info, or any general information like an address or a phone number, or the HDAP team would be the best team to initially contact if your client is having problems at the pharmacy getting their meds. The Bridge team should be contacted for assistance with insurance enrollment or to triage problems the client is currently having with their insurance. We can also help with Mass Health or Health Connector determinations, or can answer any questions about reconciliation of advance premium tax credits received through the Massachusetts Health Connector. Contact our CHI for questions about insurance premium payments. I think there's somebody talking. If you could mute, that would be great. Thank you. Contact our CHI program with questions about insurance premium payments to report changes to an insurance premium or request a new insurance payment, or to discuss refund checks a client has received from the Health Connector or other insurance carriers. Next slide. HDAP created the Rapid Eligibility Determination Form, also known as the RED form, to provide quick access to life-saving HIV medications for newly diagnosed clients. The RED form can also be used by clients who aren't necessarily newly diagnosed but have never been active in the HDAP program before. Clients receive temporary HDAP coverage pending a long form and required supporting documents, but no supporting documents are required with the RED form for the initial temporary coverage. The form must be completed in full and signed by both the client and a clinician, and will be processed urgently when it's received. Best to submit RED forms via CRI's secure email portal and to title the email as urgent/RED, or call the main number for RED forms that are faxed to request urgent processing. Next slide. This slide just gives an overview of the RED form itself, which is very similar to the one-page self-attestation form. As mentioned on the previous slide, the form must be signed by both the client and the provider, but no supporting documents are required for clients to get temporary coverage pending a long form. Next slide. In addition to the Health Connector's annual open enrollment, Medicare open enrollment began on October 5th and October 15th and runs until December 7th. During this time, Medicare beneficiaries can enroll in or change their Medicare Part D prescription drug coverage, or their Part C, which are also known as Medicare Advantage plans. The Bridge team has 2 certified Shine counselors. I am one of them. My colleague David Huckle is the other. And we are happy to assist your Medicare clients with enrollments. Medicare has 2 other enrollment periods detailed on this slide that run concurrently from January 1st to March 31st. They're primarily Medicare Advantage. Open enrollment would be an opportunity for people who have the Medicare Advantage plan to make a one-time change to a different plan or to go back to original Medicare and enroll in a Part D plan. And the Medicare general enrollment period is for people who did not sign up for Medicare Part B during their initial enrollment period or who missed a special enrollment period. They can use the general enrollment to enroll in this coverage, but please make note that their coverage will not be effective until July 1st. So we do encourage clients who become Medicare eligible to enroll in what they need to enroll in during their initial enrollment period. Please contact the Bridge team with any questions about Medicare. Next slide. HDAP is the umbrella term for the Infectious Disease Assistance Program funded by the Massachusetts Department of Public Health and administered and run by CRI. These programs include TB-DAP, which is a tuberculosis drug assistance program, PrEP-DAP, which is pre-exposure prophylaxis drug assistance program, NPEP, non-occupational post-exposure prophylaxis program, and HDAP, our HIV drug assistance program. Under the HDAP program, the CHI program, which is the Comprehensive Health Insurance Initiative that offers health insurance premium assistance, and the Bridge team for benefits, resources, infectious disease guidance, and education, all operate under the HDAP program. Next slide. The goal of the Bridge team is really to keep Massachusetts residents living with HIV enrolled in HDAP and enrolled in comprehensive health insurance coverage so they have access to care and life-saving medications. The Bridge team is also able to help reduce the HDAP application processing time by being the team where HDAP can refer clients who have insurance needs. The Bridge team also assists our PrEP-DAP clients with insurance navigation on an as-needed basis. Next slide. The Bridge team also provides training and technical assistance to case managers and other clinic staff to assist clients with insurance navigation and HDAP application, who assist clients with insurance navigation and HDAP applications. We provide similar services to clients and consumer groups as well. Prior Bridge presentations are posted on our website for people who may have missed these trainings or would like a refresher, and are also especially helpful for new case managers who are just beginning to work with clients living with HIV and applying to HDAP. Please contact the Bridge team if you would like to request a training or technical assistance. Next slide. Open enrollment and the Mass Health Connector for 2022. Next slide. The Massachusetts Health Connector is the state's health and insurance exchange that most of our clients use to apply for and retain health insurance coverage. Client applications are screened for Mass Health, Health Safety Net, subsidized connector care plans, and other health connector plans with and without subsidies. Mass Health will continue coverage through the end of the COVID-19 public health emergency for individuals who are currently active with Mass Health but may no longer qualify. Mass Health clients may be getting requests to renew their coverage or submit additional documentation. We strongly encourage clients not to ignore these requests, as it could result in benefits terming for individuals who may still qualify for Mass Health coverage when the public health emergency ends. Next slide. To purchase health insurance through the Massachusetts Health Connector, individuals must be a Massachusetts resident who is lawfully present and not incarcerated. Undocumented individuals are not eligible for Health Connector coverage, but they may submit a paper application to be screened for Mass Health Limited and Health Safety Net. We will discuss the options available for undocumented clients later in this webinar. What is open enrollment? Open enrollment runs from November 1st through January 23rd. During this time, individuals and families can enroll in coverage or change their existing insurance coverage. Most HDAP clients will use the Massachusetts Health Connector to do this, but individuals can also purchase insurance during open enrollment directly from an insurance carrier, agent, or broker. Outside of open enrollment, most individuals cannot enroll in or change their coverage unless they qualify for a special enrollment period because of a qualifying life event. Individuals and families who qualify for Mass Health and Health Safety Net can access this coverage at any time of year. This slide just details some common special enrollment periods related to qualifying life events. The special enrollment window is typically a 60-day window, so please make note of that. Some of the more common life events that allow for a special enrollment period are a change in family size or marital status, a move to Massachusetts from another state, a change in citizenship status, or a loss of health insurance coverage for a reason other than failure to pay a premium. I am going to turn this webinar over to my colleague David Huckle, also on the Bridge team now. Thank you.
Thank you, Anne. Hi, everyone. My name is David Huckle. As Anne said, I'm also a health insurance enrollment specialist on the Bridge team and also a Shine counselor. This slide shows the timeline for open enrollment and some of the important deadlines. And open enrollment begins on November 1st. And in order for a client's plan to start effective January 1st for 2022, the Health Connector will need to receive the first payment for their premium for that plan by the 16th of the month in order for payment to get over to the Health Connector by the 23rd. We recommend that clients complete this process during this time frame so that there's not an unexpected change in their coverage during the month of January. But if there is, clients will have the opportunity to complete this process for effective date February 1st. And at that'll be kind of your last chance during open enrollment to update your information with the Health Connector and get enrolled into a new plan for February 1st. And again, the CHI program will need to receive the premium information, so the amount of that the premium costs and the name of the plan by the 16th of the month in order for payment to arrive at the Health Connector by the 23rd. Next slide, please. So there's multiple ways to submit an application for health insurance through the connector. We recommend applying online if possible. The online portal is a great place to log in and verify your enrollment information. You can see your personal information, the income that they have on file for your clients, and you'd have the ability to make any updates to your application and also upload documents that may be requested. The next best option is to apply over the phone. The screening questions that clients will get asked over the phone are going to be the same as the ones that are asked online. And after completing that process, clients can wait to receive their first premium bill and submit that to CHI by the 16th of the month. But also, if the client is enrolling in the middle of the month and there may not be enough time to receive that bill and send it to CHI by the 16th, you can ask the representative to tell you the details of the client's enrollment over the phone, and then you can send that information to CHI via secure email. The details that you would need to record are the name of the plan, the amount of the premium, and also the client's income in the form of a federal poverty level percentage if possible. Afterwards, the client will still receive that premium bill in the mail, and that will still need to be submitted to the CHI program. Next slide, please. So on the online application and also over the phone and also on the paper application, which I didn't mention on the last slide, but that's another option to apply for Mass Health, is going to ask you this really important question, asking if clients want help paying for their health coverage. And our CHI program requires that clients answer yes to this question, because if you answer yes to this question, this ensures that you will be screened for subsidies which lower the cost of insurance. So that includes Mass Health coverage or connector care coverage and also advanced premium tax credits. And so our CHI program requires that clients will accept any subsidies that they are eligible for. And so it's really important that you answer yes to this question, asking if you want help paying for your health insurance coverage. Next slide. There's also going to be a question about, two questions actually, about advanced premium tax credits. We have an example here on the slide, but clients will have to agree to file their taxes and reconcile their advanced premium tax credits for the upcoming year. And they also have to confirm that they have reconciled their advanced premium tax credits for prior tax years. And the CHI program requires that clients agree to both of these questions so that they can get screened and receive the subsidies if eligible. If a client is not sure if they have reconciled their APTCs in the past, clients should still sign off on these statements, and they will have 90 days to complete the reconciliation for prior tax years, and you can reach out to the Bridge team for assistance with that. Next slide, please. So here are some tips for reporting your income for 2022. Reporting clients' income is a really important process of the enrollment process. It's critical to getting screened for appropriate subsidies that they may be eligible for. And so when clients are first applying for insurance, they have to provide information on their income, but also clients that are currently enrolled in insurance through the connector have to confirm that the income that the Health Connector has for them on file is correct and update that income if it's not currently correct. And really this has to happen once per year and during open enrollment. So some tips for that to help the process go smoothly is just encourage your clients to prepare their income information before they apply. This helps to save everyone time. And keep in mind, clients will need to report all of their current income and also provide an estimate of the income they expect to receive in the upcoming year. And you should know that clients do need to report their unemployment income both as current income, if it's currently being received, and also in their estimated income for the following year, if applicable. And just a reminder that it's totally okay to report your best estimate in terms of your income. It's common for clients to have income that is unstable in terms of, unpredictable hours or seasonal work. And so the Health Connector will provide lots of options for how you can report that income in terms of the pay rate and the hours worked. And so it's okay to estimate there. But you want to keep in mind that clients may be required to submit proof of income if the Health Connector requests it after submitting their application. Next slide, please. So this slide shows a flow process for applying for when you apply for health insurance through the connector during open enrollment. So the first step is you submit your application, and that's going to contain all of your eligibility factors, so your income and other statuses that factor into your eligibility. So if a client is eligible for Mass Health, they will be determined to be eligible, and they will also be enrolled into whatever Mass Health program they're eligible for. And the plan selection process would be another step after that. But for clients that are not eligible for Mass Health, but they are eligible for connector care, meaning they make up to 300% of the federal poverty level, then they will be shown to be determined for a connector care plan. Clients that make between 300% and 400% of the federal poverty level will also be screened and found eligible, most likely, for advanced premium tax credits. And clients that make greater than 400% of the federal poverty level will not qualify for advanced premium tax credits, and so they will be found eligible for health connector plans, also known as qualified health plans, and I'll be presenting some more info about these plans in the following slides. But after you find out what program you're eligible for, if you are, and then you complete an enrollment into an appropriate plan, you want to send that premium information to CHI by the 16th of the month so that they can send that payment to the Health Connector on time. And next slide. So once you complete the online application process, you'll see a page like this. And this will show the client's program eligibility. So if you see in the middle of the page at the bottom, it says you qualify for these programs. And in this example, the client qualifies for Health Connector plans. So this is referring to qualified health plans, which are available at different tiers. And we require that clients enroll into a platinum level plan. And I'll show you more details on that on future slides. Other important info here is you can see the client's federal poverty level percentage. And so here you see that they make greater than 400% of federal poverty. And so it makes sense that they are not eligible for connector care. And instead they say that they are eligible for health connector plans. And so after you see this screen, if they're eligible for connector care or health connector plans, you'll have to complete another step to enroll them into a plan. All right, next slide, please. So in order to fully process somebody's eligibility, or rather, in order for Mass Health or the Health Connector to make a final eligibility determination, they may ask for some proof of the following factors from clients in order to process that. So clients may need to submit proof of Massachusetts residency, their income, their social security number, their citizenship or immigration status, incarceration status, and whether or not they are a member of an American Indian, Native Alaskan tribe. If these verifications are required, clients are going to receive a notice in the mail called that we call an RFI, request for information, and it will specify what proofs are needed and the deadline to submit those proofs. Oftentimes, this will also show up on the final page of the online application as well, but clients do receive this notice in the mail. So it's really important that clients keep an eye out for mail that comes to them from the Health Connector or Mass Health, because if it is a request for information, and it doesn't get responded to, if this information doesn't get submitted, then the client could lose their eligibility for Mass Health or other subsidies. And if this occurs for someone who is, say, in a connector care plan, there's a chance that they might lose that eligibility. And if it's outside of open enrollment, then it might be difficult for them to get back into it. So if that were to happen, you can reach out to the Bridge team. We can do our best to help by filing an appeal, for example, but we can't guarantee that that would be successful. So just to reemphasize, clients are going to be receiving notices at this time of year, and after doing an enrollment, it's possible that Mass Health or the Health Connector will send out a request for information. And on the next slide, I'll show you a way to provide that online. Next slide, please. So the online portal has a feature where you can upload documents associated with your application. And so this is a convenient way where clients could upload a pay stub or a document that certifies they're a Massachusetts resident, for example. But another way to submit this information would be via fax at the number here on this slide, or also you could mail it to the Health Connector at the address on this slide. Next slide. So other than requests for information, the Health Connector is going to be sending out notices to clients that are currently enrolled in insurance through the Massachusetts Health Connector. And this is a timeline and a description of the notices that will be received. So during the middle to late of September, clients should have received a preliminary eligibility notice. And this notice is going to report the income information and program eligibility that a client is being found to be eligible for. So the Health Connector has their own systems that can determine how much money somebody makes, and they will make a preliminary determination on their own, and they report it to the client in the form of this notice. So clients should review this information and make sure that it is correct, that they have, the correct income for them on file. And if it's not correct, then they should update that information with the Health Connector and complete a new enrollment if appropriate. During October or November, clients will receive a final renewal notice, and this will include information also about program eligibility, but also the name of a new plan or the same plan that the client is going to be automatically enrolled in if they don't take any action. So I'll have an example of this on the following slide. But again, it's just really important to review this, make sure it's correct, and also you'll want to submit this new enrollment information to HDAP and CHI. And in December of 2021, clients will receive their first premium bill for the month of January, and that premium information has to be sent to the CHI program by the 16th of the month, so December 16th, in order for the plan to be effective January 1st. Next slide, please. So this is an example of a final renewal notice from the Health Connector. You can see at the top that there are various columns, and you can see the client's program eligibility for 2021, the current health plan that they're enrolled in, and the new plan that they're going to be automatically enrolled in if they don't take any action. And so this is a sign that this client would need to update the Health Connector with their current information, most likely, because you can see that they currently have a connector care plan, and it looks as though they are going to be placed into a standard silver plan, which is not a platinum plan, and it's also not a connector care plan. So if that's unexpected, then the client should update their information so that they stay in a connector care level plan. And you can see we've highlighted these other portions of the document where it says you will no longer be able to get help paying for your insurance coverage through a connector care plan. And it asks you at the bottom to please update your information right away if you think your eligibility is not right. So this is an example of the types of the notice that will be sent out to clients and areas that you can review to make sure that the information is accurate. And it will directly ask you to respond and update your info if it doesn't look accurate. Next, and this is especially important for clients with connector care this year, because of the American Rescue Plan. Any clients that received unemployment income during 2021 were eligible for connector care plans, even if they might not have been before. And that eligibility is going to be ending at the end of this year. And so it's especially important for clients who may have gotten this into one of these connector care plans due to receiving unemployment, that they review this information and just keep in mind that they may be automatically enrolled and into a qualified health plan. And often that's at the silver level, and we would need them to change that and enroll into a platinum level plan. And I'll explain the importance of that on the upcoming slides. Next slide, please. So a brief overview of what connector care plans are. These are the most subsidized plans through the Health Connector, which are qualified health plans. And they're available to households earning up to 300% of federal poverty level. And they are have low costs for accessing care. So it's beneficial for everyone, for clients to be enrolled in these plans when they're eligible for them. And also keep in mind that connector care plans are not the same as health connector plans. They are different because they are more subsidized. Next slide, please. So these are the different types of qualified health plans that are offered. So again, these are more expensive than connector care plans, and they're referred to as health connector plans on eligibility determinations. And we've circled the platinum level plans here because that is the level that our CHI program requires clients to enroll in, because it will have the highest it'll have the highest premium cost, which our program will cover, but also the lowest cost of accessing care. And it will also have a $0 deductible, which is really important for our program. Next slide, please. So this is just a helpful tip. If you're using the online portal to enroll in a plan, you can use a filter feature over here on the left, where you can check off platinum and then hit apply filter, and that will show you all of the platinum level plans that are available for your client to enroll in. And of the plans that are available, you'll want to make sure that you select a plan that is appropriate for your client for a couple of different factors, and I'll go over those on the next slide. So, as I said before, the client would need to select a platinum level plan because it would have $0 deductible. And other really important things to consider are whether or not your client's providers that they see, all of their providers, whether they are in network with the plan before you choose that plan. You don't want to choose a plan that their providers are not in network for, because then your client wouldn't be able to use their insurance to see them. So we recommend that you call that insurer to confirm the provider's participation, and you can also call the client's providers to check and verify that they accept that insurance. Another important thing to consider is that the insurance plan will cover all of the prescriptions that the client takes. Usually they do, but it's still important to check, and you can check their drug formulary, which is a list of the covered drugs, just to make sure that it includes all of their prescriptions. And you can also call an insurer to confirm that those drugs are covered. Next slide. Oh, and I'm actually going to hand it off to my colleague Juan from here to take over the presentation from here.
Thank you so much, David, and thanks everyone for joining us today. My name is Juan Diaz, and I'm also a health insurance enrollment specialist at the Bridge team. And now I'm going to talk to you about how the Health Connector relates to our HDAP's CHI program. Next slide, please. So in the way that they relay is in the premium payment information that needs to be documented and sent to SHE in order for SHE to process this payment by sending them to the Health Connector on time by the deadline of the 23rd. So the Health Connector premium bills are due, like David mentioned, to SHE on the 16th. So that is to ensure that SHE has enough time to be able to send that payment to the Health Connector because the deadline is the 23rd of each month. So for example, for any insurance that will become effective or active on January 1st of 2022, the deadline for the payment that she has to send to the Health Connector has to be received by the 23rd. So it is important. As you notice, we've been repetitive with this information because we also want you to be really repetitive with our clients as a reminder that this information has deadlines that needs to be submitted on time. If an initial payment bill is not available, she again can accept the following information to make a payment for the first month's premium. So you can use the My Enrollment page from the online application showing the plan selection and the payment information. And again, a reminder, very important, make sure that the client full name is spelled correctly on this information so that that will not create problems in the future for processing. You can also document a case manager letter stating the exact premium amount information, the plan name and type, and any other relevant information if you know it as the federal poverty level percentage and any FPL that the client might be eligible for. Next slide, please. So it is important that we all work together in trying to help our clients retain their SHE coverage. So as you know, it's a team effort from the Bridge team, SHE, HDAP, and all case managers to work together to ensure that our clients are actively enrolled in HDAP and that we can continue to pay for their SHE coverage. So clients should send their monthly premiums to SHE, even if there's no changes in rate. So it doesn't matter if a client gets a 0 or gets a $20 increment in the bill, ask them to send us the bill every month as a reminder. And the bills, as you know, we've been also sharing this with case managers that sometimes ask us about the bill being double-sided. So yes, the bills from the Health Connector have information on the back that we would like you to remind your clients to send the front and the back of the premium bill so they can scan it or they can send it to you, scan it and send it to SHE at this email address on this slide for faster processing. You can also fax these bills to the HDAP fax number on this slide. The Health Connector plans are at risk of cancellation if SHE does not receive monthly premium statements that reflect an increase in the monthly premium amount due. So again, we're going to be very repetitive because the message here we want to convey is that you do remind your clients on how important it is to get that information to us as soon as possible. So HDAP and SHE and the Massachusetts Health Connector. In general, SHE can pay for a Health Connector plan for an active HDAP client if the client does not have access to employee sponsor insurance or the client's employee sponsor insurance has a high deductible of $500 or more or has any other out-of-pocket cost sharing. The clients also could face other barriers in accessing insurance, such as providers that are not in network with the employer plan. So we worked with G and the bridge team to evaluate this on a case-by-case basis. HDAP clients who are eligible for connected care plans are required to enroll in these plans in order to receive premium assistance, and this is something that David also spoke on his slides. So again, very important. Next slide, please. So in general, she can pay for the Health Connector plan if the client is active. I already covered this slide, so I'm gonna move on to the next slide. So now I'm going to talk to you about special considerations for immigrants, including the undocumented. And we will explain these in the next few slides and how we would like you to understand how we would like our undocumented client to apply using Mass Health application just because they cannot apply through the Health Connector. Next slide, please. So the health safety net for undocumented individuals and other pending insurance enrollment. So again, the health safety net is an assistance program that pays for certain essential care services at an acute care hospitals and community health centers for qualified uninsured and underinsured Massachusetts residents. It is not insurance and it cannot be used at tax time to show that they were covered by health insurance. However, it does cover routine HIV care and medications received at any HSN sites and pharmacies. The health safety net is available to uninsured and underinsured Massachusetts residents whose family income is under a certain percentage of the federal poverty level. Next slide, please. So in here, we want to talk about the different types of insurance that potentially an undocumented individual could apply. So uninsured and underinsured individuals. So undocumented individuals should apply using a paper application to be screened for Mass Health Limited, Health Safety Net Partial, and should receive an eligibility mailed to them. So it is very important that once you submit a paper application that you remind your clients to be on the lookout for a determination notice that they should receive in the mail. Mass Health Limited covers certain emergency services for people who have immigration statuses that keeps them from getting more coverage. Clients that are eligible for Mass Health Limited are often eligible for Health Safety Net. Together, these can cover basic services, and many clients will be sufficiently covered under these. However, they are not comprehensive insurance, and so they do not exempt clients from tax penalty due to being technically insured. The Health Safety Net Full is an assistance that is often that is offered based on income less than 150% of the federal poverty level. And the Health Safety Net Partial has an annual deductible that clients will meet throughout the year. HSN Partial is based on an income in between 150% to 300% of the federal poverty level. Certain services include seeing specialists that will not be covered by Mass Health Limited or HSN. So if you have any client that is facing this difficulty, please contact a member of the bridge team to discuss other potential options for these clients. A non-group individual policy is also purchased directly through an insurer during open enrollments or after a qualifying life event. And again, these types of insurance might have other costs such as deductible co-payments or other hidden costs that the clients sometimes don't understand. So it is important that you always reach out to the bridge team or CHI if you have any specific questions. Next slide, please. So it is important, HSN reminders to take into consideration that while HSN coverage at an HSN site is adequate for many clients, many clients, it may not cover all medical procedures, treatments, medications, or specialists needed by some clients. If HSN does not cover all of your clients' healthcare needs, please consult with a member of the bridge team to explore other coverage options. With direct pay private insurance plans like Blue Cross Blue Shield, HMO Blue premium plans, clients may face co-payments and co-insurance for medical care not present under HSN and is not reimbursable by HDAP sheet. Consider this option carefully and reach out to Chi or the bridge team with any specific questions. Next slide, please. So now I'm going to leave you with some great resources that you will have. I will encourage you to review and add to your computer search engines and use as needed. Next slide, please. And now this is how you can contact the bridge team, David, and myself. If you have any questions, this is our contact information. Please feel free to reach out to us and also encourage your clients to reach out to the bridge team with any questions that they might have. And now next, I'm going to turn it over to my colleague, Kevin Herwick from the PrepDAP and NPEP programs, who will be talking to you about his programs. Thank you so much, and take it away, Kevin.
Thanks so much, Juan, and also Anne and David. So I'm Kevin Herwig. I manage the PrepDAP and the NPEP programs, which are our drug assistance programs here in Massachusetts that pay for HIV pre and post exposure prophylaxis, or PrEP and PEP. Just as a reminder for any people in the audience who might be unfamiliar, PEP and PrEP are ways that people who are at risk for HIV can take antiretroviral drugs to prevent HIV. PEP is taken after a particular possible exposure, and you have to start it within 72 hours and then continue it for 28 to 30 days. So PEP is always super urgent, very time sensitive. PrEP is taken for by individuals as long as they're at risk for HIV. It's usually 1 pill a day, but we're looking forward to new modes of long-acting PrEP that are coming our way, possibly even quite soon. So so here we have a PrepDAP and NPEP program. Sorry, NPEP isn't actually referred to in this slide, but so in PrepDAP, we help people gain very quick access to PrEP, and NPEP is the same for PEP. We can usually approve coverage within an hour of getting paperwork. We pay people's out-of-pocket costs for the PEP or PEP drugs, and also in collaboration with our bridge team, we can help with insurance issues and insurance enrollment, which is very important. Basically, we're always happy to hear from providers, case managers, individuals about anyone in Massachusetts who's having a hard time accessing PEP or PrEP. And please do give us a call on our direct lines that you can see here in the slide. My direct line and Kat Baker's direct line. You should usually be able to reach one or both of us until 6 p.m. Every day. So just moving on to barriers, PrEP-related barriers with insurance. So issues around PrEP and insurance have gotten a bit more complicated now. So there's basically been some great news in 2021. Many people now do not have copays for PrEP, many people on certain insurance plans, but many still do. So please do call us in PrepDAP with any questions, and we're usually able to find solutions. So our colleagues in the bridge team are also able to help PrepDAP or NPEP clients enroll in insurance. Please, in this case, contact PrepDAP staff, and we'll do a very warm handoff to our colleagues in the bridge team. And so that's, we just wanted to give you a brief reminder about PrepDAP and NPEP as they relate to open enrollment. Thank you.
Hi, everyone. So this is Anne. I'm putting myself on camera now. Thank you so much for joining us, and we would like to open this up to questions you have regarding open enrollment. I don't see that any questions have been posted into the chat. So if you'd like to ask a question, you could take your phone or your computer off mute, and fire away. No questions. So I made a couple of notes while the presentation was going on, so I am just going to add a few more things. So when David was talking to you about the notices that clients receive from the Massachusetts Health Connector during open enrollment, the final renewal notices that are sent to clients that talk about whether or not they're being enrolled into the same plan or being moved to another plan do include helpful information, including that FPL, that the HDAP program sometimes needs to recertify a client. So have your clients hold on to those notices, bring them into the office. That FPL might be very well buried on that document, but there is typically a section of that document that explains how the Health Connector made the determination for what kind of coverage your clients qualify for. So keep an eye out for that, because HDAP frequently needs those Health Connector determinations or Mass Health determinations in order to recertify clients. The other note I made was also on one of David's slides that was just about the Special American Rescue Plan connector care eligibility for people who collected unemployment in 2021. So David did say that that is going away for 2022. Some of those clients might actually be over income for connector care plans. So David was talking about the importance of making sure if they get moved into a silver level plan, that we're maybe actively pursuing putting them into a platinum plan during open enrollment if they truly no longer qualify for connector care level plans. But many of those clients may still qualify for connector care plans. They might just be now in a connector care plan where the premium has gone from zero because of their unemployment and the American Rescue Plan to an actual monthly premium that's due. So making sure that our CHI program knows that that client who they weren't paying for suddenly has a premium for their coverage that starts on January 1st is really, really helpful information to share with us. And now now that I've done my little bit, I'm gonna open it up again and see if there are any questions, if there's anybody who joined in the middle of the presentation who wants to put their name and health center in the chat. No questions. I'm thinking we did such a good job with, here we go. An approved RED form, so that's the Rapid Eligibility Determination form, covers clients' meds at 100%. What about doctor's visits and labs while awaiting insurance coverage? So that's not actually true. I mean, it might be true in certain circumstances, but the RED form can also be used by a client who has insurance coverage and needs their $50 copay paid at the pharmacy. So it's not 100%. It's just medication assistance, whether that's a copay through their active insurance plan or whether they need 100% coverage while they're applying for health insurance coverage. But HDAP and CHI are never able to pay the costs for doctors' visits and labs while awaiting insurance coverage. So if you are working with a client who has no insurance coverage at all, I would encourage you to complete the Mass Health application with them as quickly as possible to see if they might qualify for a Mass Health program or something like Health Safety Net that might be able to help them with those costs. I don't know whether anybody else on Bridge has anything else to add to that. We have a similar case that I'd like to discuss on record. So, I mean, if you're off record, I was wondering about that. So you can definitely reach out to the Bridge team and we can certainly discuss that in more detail. You would want to call the main numbers 617-502-1700. I can put that in the chat, and then you enter 1 followed the number 1 followed by the number 5, and that will connect you directly to the Bridge team. If nobody is available to answer the Bridge line, you can leave a voicemail and we will call you back. And I am happy to put that into the chat. Anything else? Oops, and I put a typo in the chat. But anyway, that's the number for the Bridge team. Sorry, I missed the B there somehow. Any other questions? You know, we have 24 minutes left on this meeting, but if there are no questions, we can wrap it up. Well, thank you all for joining us today for CRI's open enrollment webinar. We will post the slides and the recording for this webinar on our website in the next few weeks, or probably the next week, really. If you have any colleagues who weren't able to attend today and you want to refer them to our website to listen to this open enrollment webinar, we also have some webinars we did over the summer posted there as well, an HDAP CHI 101 and an HDAP application webinar. So there are no other questions. I am going to say we should call it a day, and thank you again for joining us. Bye, everyone.
Thank you. Bye-bye.
Bye, everyone.